Hey everyone out there, it's Roberto Miki again, and we've got another great hand question of the week. It's July 5th, 2025. This is number 61 in our series. Well, let's get right into it. Which substance increases serum uric acid levels? Well, A, losartan, B, lead, C, high fructose corn syrup, D, vitamin C, or E, alcohol. Here's your chance to pause the video, think about the question, and answer it. Explanation. The risk of a gouty flare is increased by alcohol consumption, lead exposure, high fructose corn syrup, and purine-rich foods such as meat and seafood. Renal failure and dehydration also increase the risk. Similar to alcohol, high fructose corn syrup may increase uric acid levels by preoccupying the liver due to the metabolism of fructose occurring primarily in the liver. Here's a reference. And the answer is B, lead, C, high fructose corn syrup, and E, alcohol. Losartan and vitamin C actually lower uric acid levels and decrease the risk of a gouty flare. Well, hope you enjoyed the video. Remember to hit like and subscribe, and we'll see you in the next one.